most of my patients also deal with psoriasis.
Oh, yeah.
Because whenever there's a gut problem, some other autoimmune disease is coexisted somehow. It could be lichen planus, it could be psoriasis.
Yeah.
So tell me, how does a patient know that, okay, he's developing psoriasis? Symptoms. Is it like dry flakes?
Psoriasis is a loud disease. There is no two ways doubting that whether I have it or not,
I
right?
see.
I would start off by saying this, that psoriasis is highly misunderstood. People do the biggest mistake of treating psoriasis as just a skin condition. For me, I take pride. That's why I said thank you for bringing this, because I take pride in treating my psoriasis patients with just dietary and lifestyle changes. I hardly give medications to my psoriasis patients. Yes, it might take a little longer time to give results, but that gives sustained results, and relapses are very low. And even if the relapse come, it's not as strong as previous
before.
relapses. And it can be easily managed with just topical and diet. So psoriasis, like you were asking, Doc, it comes as thick plaques, red thick plaques onto the skin. It's itchy in most scenarios, and it's very uncomfortable to the patients, right? It can come anywhere on the body, scalp to toe. It can affect any part of your body.
Most common?
Most common, we see the truncal area.
Truncal
Scalp
area.
is also very common, but truncal area is the most
Abdomen.
commonest. Abdomen, back. Hands. It can happen anywhere. But yeah, like you said, most commonest is the truncal area.
So they come with psoriasis treatment, or they come and say, okay, what is this diagnosis?
Most of them come saying it is psoriasis. Because also by then they would have already been diagnosed with psoriasis. Multiple times.
Okay.
And if they're bringing their children, they know it is psoriasis because they had psoriasis, as a child, or even
before.
as parents. They know that most likely it's very rare that what is this with psoriasis happening. That's why I said it's well aware already.
Okay.
But what they're not aware is what is causing it. And once we try to fix that, it is a life-changing exercise that we do. So psoriasis, like I said, it's not just about skin, right? It starts with gut. For me, most of the psoriasis is because of gut issues, the leaky gut. And then adding on to that will come your stress. Stress, boom, psoriasis, right? And then you see lack of sleep, the gut issues we covered with diet, right? Sleep, stress is the most important factor. Sometimes we see that psoriasis as a first episode triggers after you get some upper respiratory tract infection, or you fall sick and then you're recovering, and then you suddenly get, because your immunity is going down and the autoimmunity kicks in, and then you start to get your psoriasis. But now I want to ask you this. We know this leaky gut is the problem, right? Do you want to throw some light upon why leaky gut happens and what happens for this kind of inflammatory conditions to kick in?
So as you know, there are lots of immune cells lining the intestine, mainly in the terminal part of the small intestine. And what we have seen is that whenever there is a disturbance in the lining of the gut, it could be anything. It could be stress, it could be lack of fiber, it could be lack of fermented food. These immune cells will not start working properly.
Right.
Will not start working. So then the immune cells create this cascade that your body doesn't belong to you.
Yeah.
And it starts eating up your own body, basically. So as a gastroenterologist, I see a lot of ulcerative colitis, Crohn's disease, where they eat up your own colon, large intestine, thinking that it doesn't belong to you. But more commonly, psoriasis is almost the same thing, where it reaches the deeper layers of the skin and then telling you that, okay, see, your gut is not right.
Not right. So I have a very strict diet policy. We give the diet charts to the patients. We also had a program. Now it's becoming overwhelming for us to do all this, so we've taken a break from that. We had a program called DNA 360, wherein we had a nutritionist, we had a gynecologist. So it's a multidisciplinary bench we had, and we used to guide our patients accordingly. So after me, they used to go to the dietitian, understand, work with them, do all the tests that's necessary. So we used to curate the entire program for them. So first thing is diet. So we have a very strict diet chart where we say no to certain foods. Irrespective of whether it's suiting you or not, there are some foods that are blanket no. And then the stress management becomes very, very important. Like I said, we clearly see CS walking into the clinic in July, June, post the closure. They've gone through late night work, very heavy, stressful work, and they come with psoriatic flares, students after their exams.
Stress worsens the psoriasis.
Direct correlation. You can just see instant flare-ups, like in a month or two. Stress, and then poor sleep cycle, smoking, again worsens your psoriasis. So these are the corrective lifestyle choices. Then something as minor as taking extreme hot water bath, taking long showers will again cause stripping your skin of its natural barrier, transepidermal water loss.
What is the thing with the hot water baths? What does it that do to the skin?
Oh, we all love it. It's very relaxing, but it is causing dehydration. It is stripping your skin of the barrier, and then it is causing a lot of transepidermal water loss. Your pores are more dilated. You tend to lose a lot of water. Do you feel this when you take very hot water bath? You feel like scratching your back, and it's very relaxing feeling.
Yes.
That's because of histamine release, and we don't want that in our eczemas or psoriatic patients. No, because we have a lot of it already. Why do you want to further trigger it? So absolutely no hot water for them. It is cold water or lukewarm water bath. Extreme cold is also not necessary, just lukewarm. That much is enough. Wearing skin-friendly fabrics, wearing only loose cotton clothing. Avoid any synthetic rayon, nylon fabrics at all costs, because it causes static, irritating the skin, not just letting it be comfortable. So these are the minor changes that we also look into.
Right. I see a lot of patients with GI problems coming down to my clinic who are night shift workers and also having psoriasis problems.
Direct correlation.
So, sleep is a problem, but whenever there is a stressful period, again, the brain-gut axis connection is not good. So, again, the immune cells are at disadvantage.
Yeah.
So, then the flare-up is coming. So, you will not believe every time they come and see me, the next appointment is dermatology. All the time.
Yeah.
All the time.
Yeah.
So it makes a huge correlation over there. The repair hormones, your growth hormones and all your reparative hormones are secreted more based on the circadian rhythm
Correct.
during the last phase of the REM cycle. So each REM cycle is 90 minutes. So you need to have minimum of 5 to 6 REM cycles. So just based on circadian rhythm itself, if you want that final push, it needs to be that 5th or 6th REM cycle. You will not get it if it is less than 6 hours. So that is the angle. Yes, some people say that, yes, I don't need 7 hours of sleep. I just need 6 hours of sleep. That is, it is not reflecting on your body as of now.
Okay.
Maybe you are even more productive if you get that.
Because you're young and your body is able to take it, so
correct.
it is doing. But as you grow older, I think it makes sense. Yeah.
Yes.
Yeah, but I'm more particular about the time. I would say please make yourself put yourself to sleep by 9:30, 10. That is non-negotiable. Turn off your lights. I know it is very very difficult for many people. So 9:30 your lights must go off. You should calm yourself down before sleeping, unwind yourself, and then sleep by 10.
That's normal for any skin patient, right? Anybody.
Everybody, but all the more important for people with autoimmune disorders.
Correct.
Like psoriasis and all. It's much more important.
And that is because the melatonin secretion.
Plays a huge role, especially with your hair. Overall skin health also. Again, circadian plays a role in when it is secreted, how much it is secreted. Now people are like, okay, I'll take melatonin supplements.
Yeah.
That is come, but nothing better than your body naturally repairing itself. So sleep time is very important. Okay, I'll sleep for 7 hours, doc, but one day at 12 o'clock, one day at 10, one day. You're messing up with the circadian rhythm.
Correct.
So these are some non-negotiables when it comes to psoriasis. Sleep, diet, most important thing. And what did we cover? Diet, sleep, stress management.
Correct.
If it can be managed.
Good. And then Dr. Priyanka.
Yeah, because Dr. Priyanka will give you all this and less of medications. And Dr. Pal also, who will, through new me, I think will help you.